The United States is facing its worst outbreak of bird flu, impacting poultry farms nationwide. Millions of birds have been culled to control the spread, and the virus has now been detected on dairy farms in multiple states. This development has raised concerns about the potential risks to dairy workers who are in close contact with potentially infected animals. The situation highlights the importance of biosecurity measures and worker safety protocols in the agricultural industry. Dairy farms, with their large herds and open-air environments, present unique challenges for containing the spread of avian influenza. The virus, typically spread through bird droppings and contaminated materials, can easily be transmitted between birds and other animals, including mammals. The presence of bird flu on dairy farms poses a significant threat not only to the health of the animals, but also to the workers who care for them. The recent detection of bird flu on dairy farms has brought to light the potential for transmission of the virus to humans. While the risk of human infection is considered low, it is not impossible, as evidenced by past outbreaks in other countries. This situation underscores the need for heightened awareness and precautionary measures to protect the health and well-being of dairy workers. The current bird flu outbreak, the worst in U.S. history, serves as a stark reminder of the vulnerability of the agricultural industry to infectious diseases. The spread of the virus to dairy farms highlights the interconnectedness of animal and human health, emphasizing the need for a comprehensive approach to disease prevention and control. As the outbreak continues, the dairy industry, health officials, and policymakers must work together to mitigate the risks to both animal and human populations. Dairy workers play a critical role in maintaining the nation's milk supply, yet they often face hazardous working conditions. The threat of bird flu adds another layer of risk to their already demanding jobs. Unlike poultry workers who often wear protective gear when handling birds, dairy workers typically have limited protection when working with cows. This lack of adequate protective measures increases their vulnerability to contracting the virus. The close proximity of dairy workers to cows, particularly during milking and other routine tasks, exposes them to potentially infected bodily fluids and contaminated surfaces. The risk of infection is further amplified in poorly ventilated barns, where the virus can linger in the air. Without proper protective gear such as masks, gloves, and coveralls, dairy workers are at an elevated risk of inhaling or coming into contact with the virus. The lack of awareness about the potential risks of bird flu transmission from cows to humans further exacerbates the situation. Many dairy workers may not be aware of the symptoms of bird flu in cows or the necessary precautions to take to protect themselves. This lack of knowledge can lead to delayed diagnosis and treatment, increasing the likelihood of severe illness and potential spread of the virus. Addressing the safety concerns of dairy workers is paramount to ensuring the stability of the dairy industry. Providing workers with the necessary training, protective gear, and access to healthcare is crucial in preventing the spread of the virus and safeguarding the health of those who work tirelessly to provide essential dairy products. Health experts have expressed concern about the potential for bird flu to spread among dairy workers. They emphasize the importance of early detection, isolation of infected animals, and strict biosecurity measures on farms. The Centers for Disease Control and Prevention, CDC, has issued guidelines for preventing and controlling avian influenza in agricultural settings, stressing the need for farm owners to implement these measures to protect both human and animal health. Dr. Emily Smith dairy workers are on the front lines of this outbreak and need to be protected. Providing them with proper protective gear and training is crucial to preventing the spread of this virus. Dr. Smith's concerns are echoed by other health professionals who emphasize the importance of a proactive approach to worker safety in the face of this emerging threat. However, some dairy workers say they haven't received any information or training on bird flu. Maria Hernandez: "We're worried, but nobody has told us anything. We don't know what to look for or what to do if we get sick." Maria's experience highlights the need for clear communication and dissemination of vital information to those most vulnerable to the virus. The dairy industry maintains that it is taking the necessary precautions to protect its workers. John Davis: "The safety of our employees is our top priority. We are working closely with health officials to implement the latest guidance on biosecurity and worker safety." Despite these assurances, concerns remain about the adequacy and consistency of safety measures across different farms and states. Section 4. Safety measures vary across states. The response to the bird flu outbreak and the implementation of safety measures for dairy workers have varied across different states. Some states, like Iowa and Minnesota, have been hit hard by the virus and have implemented stricter biosecurity protocols and worker safety guidelines. These measures include mandatory reporting of sick animals, restrictions on farm visits, and increased testing of flocks. In contrast, other states with fewer cases of bird flu have been slower to implement such measures. This inconsistency in response raises concerns about a fragmented approach to a national health threat. The lack of uniform guidelines and enforcement could potentially hinder efforts to contain the spread of the virus and protect workers across state lines. The disparity in safety measures between states highlights the need for a coordinated national response to the bird flu outbreak. A unified approach, led by federal agencies and implemented in collaboration with state governments and industry stakeholders, is essential to ensure the safety of dairy workers and the integrity of the nation's food supply chain. Furthermore, the variation in response underscores the importance of addressing the underlying factors that contribute to the vulnerability of dairy workers. These factors include low wages, lack of access to healthcare, and fear of retaliation for speaking out about safety concerns. Addressing these systemic issues is crucial to creating a safer and more equitable work environment for dairy workers. Section 5. Calls for action and industry response. Worker advocacy groups are calling for stricter regulations and enforcement to protect dairy workers from bird flu. They argue that current safety measures are inadequate and inconsistently applied, leaving workers vulnerable to infection. These groups are urging government agencies to mandate specific safety protocols, provide clear guidance to farm owners, and increase inspections to ensure compliance. The lack of action is putting workers' lives at risk, says Sarah Martinez, an advocate with the United Farm Workers Union. We need strong regulations and enforcement to ensure that dairy workers have the same protections as other essential workers. The calls for action extend beyond worker advocacy groups, with health experts and some lawmakers echoing the need for stronger safety measures. The dairy industry, while acknowledging the need for worker safety, has expressed reservations about the feasibility and cost of implementing some of the proposed regulations. They argue that many farms are already struggling financially due to the impact of the bird flu outbreak, and that additional regulations could further strain the industry. Industry representatives have emphasized the importance of voluntary compliance with safety guidelines and have called for increased government support to help farms implement necessary biosecurity measures. They have also highlighted the need for further research into the transmission of bird flu from animals to humans to better inform prevention and control strategies. Section 6. Protecting workers on the front lines. The bird flu outbreak has brought to light the often overlooked risks faced by dairy workers, who play a vital role in maintaining a crucial part of the food supply chain. As the outbreak continues, it is imperative that all stakeholders prioritize the health and safety of these essential workers. This requires a multi-pronged approach that includes strengthening safety regulations, providing adequate training and protective gear, and addressing the systemic issues that make workers vulnerable. Government agencies must take the lead in establishing clear and enforceable safety standards for dairy farms, ensuring that these standards are consistently applied across all states. This includes mandating the use of personal protective equipment, PPE, implementing comprehensive biosecurity protocols, and providing guidance on early detection and reporting of potential infections. The dairy industry has a responsibility to prioritize the well-being of its workforce by providing safe working conditions and investing in worker training and education. This includes providing workers with the necessary PPE, ensuring access to healthcare, and fostering a workplace culture that prioritizes safety and encourages the reporting of potential hazards. Moreover, it is essential to address the underlying vulnerabilities that make dairy workers particularly susceptible to exploitation and unsafe working conditions. This includes advocating for living wages, improving access to healthcare and affordable housing, and ensuring that workers have a voice in their workplace without fear of retaliation. Protecting the health and safety of dairy workers is not only a moral imperative, but also an economic necessity. By ensuring the well-being of these essential workers, we protect the integrity of our food supply chain and the health of our communities. A collaborative effort between government, industry, and worker advocacy groups is crucial to creating a safer and more equitable work environment for those who work tirelessly to provide us with essential dairy products.